Today, I'm honored to have the privilege to introduce our guest speaker in the Thoughts on Education initiative by Collegedunia.com. We have with us the principal of Manav Rachna Dental College, Dr. Arundeep Singh. How are you, sir?
Very good, Shriram. Thank you for having me on your talk. Thank you very much.
So, before delving into our conversation, could you tell our viewers a little bit about yourself and your journey in the education domain?
Well, when I started, I never thought that I'll get into education. When you get into a professional course, primarily what you're looking at is establishing your own practice and being a job giver. I did my bachelor's from College of Dental Surgery, Manipal. This was in 87 to 91, 92. And I did my master's in conservative dentistry and endodontics from Nair Hospital Dental College in 96. And immediately after that, I had an opportunity to work with one of the biggest names in dentistry during that time, Dr. L.K. Gandhi, who was also a dentist to the President of India and was into private practice. And that's what I had, thought for myself. Okay, I'll just take some training or learn the tricks of the trade and do my own practice. But then I had an opportunity by Dr. Mahesh Verma, very known figure in dental circles now, and he selected me for senior residency in Maulana Azad. And that's when I got the taste of teaching. How good it is to share your knowledge and be with the younger generation. That time I was also young, of course, but you keep on being with the younger generation, just lifts you up. So that's when I decided that I would continue teaching. So that's how I am in dentistry. I've been with Manav Rachna for last 13 years now and principal for last 7 years. So that's my journey.
As you were mentioning, sir, talking to the youth itself, I think it brings the youth inside you also. And for us also, it's a privilege because getting to know the information and knowledge that you possess, very few people have that. So it's like a two-way communication where both people are benefiting. So that is there. Talking about yourself and your position itself, as you're in charge of such an important position, what is your philosophy of leadership? How would you describe your leadership style?
I am not much of a, not that hunter-cracker kind of a person. I am more of take everybody along. And I always try to put myself in the shoes of the person that I am dealing with and try and see his point of view. Decision wise, it's my habit that I listen to everybody and finally, of course, take my own decision, but take everybody's opinion. In fact, if we are doing this virtually, if you come to my office, the quote on my board here says that if you're not here with a solution, then you're part of the problem. So I am a kind of a person who would try and elicit the solution from the person who has come with the problem and then apply my mind to it and see how we can take it forward. And that's the philosophy always. It's always thinking best for whatever we can do for the students and for the college and for the society and try and play it straight. That's the way I've always been.
That's very good to know, sir. And I think everyone has their own idea of leadership. But I think the better way to know it is like watching people like you lead people. I think that itself gives a better motivation to us also to become the future leaders like you. So I hope I can replicate that in some way. Moving on, being the principal of MRDC, how do you strategize about the key programs and plans for your administration of your college, especially amidst this COVID period? Has there been any changes, difficulties that you have faced?
Shriram, actually, like I said in my previous answer also, I do not see myself too much of an administrator.
Okay.
I came into this teaching line for my love of teaching. But yes, since before I was HOD and that was a different ballgame. But since I become a principal, then you don't have a choice. Then you have to be an administrator and something that keeps me away from my students quite a bit and which is not something too much of my liking. But at the same time, I'm really fortunate that I have a dedicated team. We have very good faculty here. We have divided our faculty into various teams. Like we have a IQAC, which is taking care of the NAC related responsibilities. Then we have anti-ragging team. Then we have a sexual harassment team. Then we have an academic team, which sit down and we meet every 3 months and strategize what we can do to take our college further. Then you also have teams for identifying scholarships and libraries. So it's a very well organized structure that I'm working with. So that way, comparatively, I am getting involved at the decision making level while people are doing the hard work, and I also we sit down, we brainstorm and do the hard work, and at the same time we arrive at consensus decisions. So that is one. Now this pandemic has really changed the way education is being delivered now. I still remember, I think 24th was the lockdown, and around 21st, our management, like we have a very progressive management, they had already foreseen it before even I thought that, it will delve into, it will go and extend so much. They're already foreseen it. They had organized a platform for our teachers. Now, this is a university. I'm part of a university. We are part of Pandit B.V. Sharma University, but for last year, we're part of Manav Rachna International University. And, it's a totally different thing. So we were given this access to Microsoft Teams. Now, the most part of the university is engineering college and psychology and other specialties, which are more tech savvy than what I thought my faculty and I myself am. And I also, dentists are more, okay, apna, you're taking care of the mouth and you're a health professional. But I was surprised, we were able to adapt so well. Within 3-4 days, we were able to transform our education from offline to online. Obviously, we were using a lot of ICT tools for our students. But within 4 days, we were trained over the weekend. I think 24th, this thing started. That Saturday, Sunday before that, we had an online training organized by our management for the faculty to how to conduct online classes, and we had our LRMs and everything already ready, and we were on the go from 22nd, 23rd onwards, and we have evolved over the last few months. We've conducted n number of webinars, which we would never have time to do this. I was telling my management, I really feel like a principal now because I'm really actively getting into taking the college forward instead of sitting in our office and just trying to push files and sign bills and checks. So this is what educationist, and this is how we would want to grow. And it's been a wonderful journey. I think we are even ready to conduct. We did online exams before anybody else. We did proctored online exams for our students. We did one session of non-proctored exams, and we found that there was a lot of hanky-panky going on. So we did proctored exam next time, and we were able to run it through. So I think it's the team that I have. Everybody was so dedicated, and they were so aligned with the vision of Manav Rachna that we should deliver quality education to our students.
As you're mentioning, sir, that you are lucky to have that well-oiled machinery, but I think the machinery itself will be lucky to have administrators like you for that to work that well. So you're being humble there, but I'll mention that to you. Next question, sir. Regards to MRDC, when you first came to the college, what was your vision and how far along in implementing that vision are you? Have you seen any changes along these years?
When I joined MRDC, it was really in its inception. It was, I think, 2006. The college started. I joined the college in 2007. Obviously, not as principal. I was head of Department of Conservative Dentistry. And coming from prestigious institutions like Maulana Azad, where I did my senior residency, then Nair Hospital, which was one of the pioneer colleges, and of course Manipal, where I did my undergraduate. I always feel your undergraduate teaching is the most important teaching, and that's how I wanted my college to be. Though we started our post-graduation in 2012, my opinion is, a postgraduate, when they are in a postgraduate program, they will always learn because they're going to be there for 3 years. But the real challenge is taking out and teaching good undergraduates, making good doctors out of undergraduate students. Post-graduation becomes a little bit more of a specialization. That's how I started. I concentrated on undergraduate teaching, and we tried to follow whatever I had learned from Manipal, from Nair, and we trained our faculty accordingly. And so we were able to take a college at a level, compared to say a institution like Manipal, which is 50 years old, or we were really babies in front of them. But the good part is within 10 years of our existence, we were able to get a NAC A grade now, which is very few colleges all over India, and none in Haryana on an individual basis have a NAC A grade. So this was an achievement that was, again, like I said, with the staff and with the vision of the management, that we were able to achieve this. So, and now the challenges is totally, with pandemic coming up, the education is going to totally change. We are, in fact, already we are searching for solutions to digitally train our students. In fact, if you talk about USA, the board exams there, the bench test and all has again totally become non-patient now, and they have evolved systems that we were also looking for, something like haptic systems and virtual reality, where we can, contactlessly. You see, dentistry is nothing without a practical. You cannot teach dentistry online. You cannot just take theory classes and say, okay, this is it. So you have to have a practical experience. Patient is the best, but in places like US also, not because of pandemic, otherwise also, getting a patient to, to an exam is a very difficult task. We used to do it from our time. We used to search for patients. Now also dental students, because they have to perform. Unlike medicine, dental students actually have to perform on the patient and demonstrate their competencies to the examiner. Unlike in MBBS, where you're probably just, diagnosing and planning a treatment. Here you're actually doing a treatment, you're doing an extraction, you're doing a flaps, you're doing a gum surgery, you're doing cleaning, you're making cavities, you're delivering dentures. So it's a more practical. So now with this pandemic, and we've already started looking for solutions which are away from patients and trying to virtually teach our students and make them compete in practice.
As you're mentioning, sir, the challenges are there, but it's the way that you're tackling them that matters. And I think MRDC has been doing a great job in that sense. Coming to that itself, sir, what according to are the greatest strengths of MRDC? Like in terms of curriculum, in terms of facilities provided, what do you think are the greatest strengths of MRDC?
Shriram, like I shared with you, we were part of Pandit Bhagwat University since our inception. Since last 1 year, we are now part of MRIIRS, which is our university. So that has given us a lot of freedom now. We have introduced for our first years, the first time, last batch, that 2019-20 batch was the first batch that has come under our university. Similarly, the first MDS batch has joined this year from 2021. The current batch is under our university. So we have really differentiated ourselves by giving them elective subjects, which is, one is the Dental Council of India curriculum, which we have to follow in any case. So we've gone much beyond them. We've given them choice-based credit system. We are encouraging them to do online courses. We are teaching them languages. We are teaching them. Some of my first-year students are learning Spanish and French, and they are learning as by final year we will be teaching them practice management. Then we are talking about dental ethics. We are talking about forensic odontology. We are talking about behavior management. So all these are things that we as students were never taught. Nobody has taught us financial management. Most of the dentists are, not capable of handling their finances. So it is something that we are learning. We are evolving. Our syllabus is being changed for our current first years, and we've introduced research innovation catalyst. Now this is a 3-year program, again a compulsory. This we've not given it as elective. We've made it as a compulsory program, and last year we started, and this year only our students were given 2 ICMR papers were sanctioned, and nearly 20 of them published, have written papers only immediately in first year only as undergraduates, which is again a very big achievement. So we are really evolving, and we want to be the best in the world.
I think in terms of the facilities that you're providing and the curriculum also you mentioned, I think it's not just being up to date, but I think you are going ahead of your time itself. I think very few colleges are being able to replicate that, the things that you have mentioned today. One final question to you, sir, before I let you go. Any suggestions you would like to give to the current youth and the aspiring students facing difficulties, especially amidst this pandemic situation?
Shriram, it's a really, really tough time for students, especially the younger generation who are, used to their freedom. Everybody's freedom is curtailed. My son is sitting in at home for last 5 months, and though he's again online classes and everything is happening, but that growth is not there. I really worry for my final year students. We are again, like, we were one of the first to have final year exams which are being conducted nowadays. I worry for them because they've missed 5 months of clinical exposure. So it's a tough time, but I think we have to accept what is there. If you cannot change it, then you have to accept it. And you should, my suggestion to everybody would be that we should use this time to expand ourselves, to be out, do out of thinking, follow your hobbies, look for some new things, some new skill that you want to learn. I've been so busy with college and practice and administration and everything that always used to feel never had time for it. So last 2 months I've started yoga on a regular basis. So I think it's something that we should all learn to kind of utilize this time to the best. I know it's a tough time. It's a really tough time for everybody. But like the old saying goes, that this too shall pass. So I'm sure all of us will come out stronger, and we have evolved also, and we've used technology, and we are moving on. But yes, of course, it cannot be the same. But we are moving on, and this too shall pass. I think that's my message to everybody. So don't give up, and stay safe, and wear your mask, do your hand hygiene, please keep distance from people, and I think we should be able to go through. So don't be scared. It should not something that hua nahi hai. It's not something to be scared of. We have to manage it, and it is in our hands to do it.
I think one thing I would like to mention is that it is expected that the current youth has a lot of energy, has a lot of positive mental attitude. But if one thing that this pandemic has shown, it's like our parents, our grandparents, it is those generations who actually possess that much mental strength, who are able to guide us. I think we are the ones who are struggling, ironically, and the people
Big
like you
struggle.
are people like you are the ones who are able to guide us. And I was mentioning, I think I've mentioned this to our previous dignitaries as well. I think I consider your generation being the golden generation for us. Till you people are there, the guidance that we have been provided with is, I think it cannot be replaced, it cannot be replicated by anyone else. So I thank you again for being with us today. The knowledge that you have imparted to the viewers, it will be valuable for them, but not just to them, for me also. It will be a lifelong experience talking to you today. So hope to
Thank
stay
you,
in touch with you. And
sure.
thank you so much for being with us today, sir.